According to data from the World Health Organization and UNICEF's Joint Monitoring Program of 2020, Namibia ranks 6th in the world in open defecation, with a startling 47% of the population affected. This has caught the attention of PDM leader McHenry Venaani, who has highlighted the urgent need to address open defecation, particularly in rural areas where the practice is most prevalent.
The practice of open defecation, which occurs in 14% of urban areas, and listen very carefully to the Honorable Authority, and 77% in rural areas, increases the spread of diseases and majority impacts public health. Less than half of our country's 2.5 million citizens use facilities that safely separate waste from human contact. Avoiding touching or even ingestion is next to impossible in Namibia's houses due to the enormous volume of human feces left behind. Children play with dirty hands in the gaps between the shacks where excrement is all over the ground, and flies may easily fly from the excrement to liquids and food. Crops are contaminated along with essential water supplies used for drinking, cooking and fishing when feces permeate into the ecosystem.
Venaani says open defecation not only affects significant health risks, but it also affects public health, making it a matter of paramount concern.
These conditions put Namibians, especially children, at risk of deadly fecal-oral diseases and infections that causes diarrhea, the second biggest killer of under-5s in our country today. While sanitation-related deficiencies such as malnutrition and stunting growth are also prevalent. The practice of open defecation causes hepatitis E outbreak in 2017. Hepatitis E is a liver disease that commonly spread through the ingestion of contaminated water. Starting in Windhoek, the disease spread more than half of the country's regions. Consumption of contaminated water can cause adults and children alike to become sick and malnourished. We have noted that 17% of children suffers from diarrhea.
Hardworking Minister.
Repeated episodes of diarrhea can result in childhood stunting, another common health problem in Namibia. A disparity between rural and urban population in this regard also exists, with 20% of rural children suffering from diarrhea compared to 15% in urban areas.
Venaani's motion highlights the need for better accountability and efficient use of funds in sanitation projects. He also calls for greater awareness and education campaigns to change cultural practices that contribute to open defecation.